So I want to talk about something that for behavior analysts and researchers in our field can be somewhat controversial, and that's the principle of presumed competence. Presumed competence is defined as the idea that individuals, even those with significant disabilities, including autism, have the capacity to learn, think, and understand, and should be treated as such regardless of their current abilities or communication methods. I recognize that treating someone as a capable human being, especially capable of more than they've necessarily demonstrated to us, doesn't sound very controversial. But in our field of ABA, it can be seen that way because as researchers and scientists, any kind of assumption in general is counterintuitive to the way we're trained and taught to discover and implement best practice, as it should be. The interventions we use as behavior analysts should always be rooted in science. But I am not speaking about presumed competence as an intervention. I'm talking about it as a general principle. There is research out there on how the concept of presumed competence can lead to uninformed decision-making and implementation of interventions that we know through research do not only not work, but also have the potential to cause harm. So let me share what I'm not saying. I'm not supporting or endorsing the use of any interventions that have been proven to do harm. But here's what I am saying. Our children with autism are whole people. They are complex human beings on their own individual journeys with self-esteem and forming their own worldviews based on the way they are treated, spoken to, and spoken about in a variety of environments, much like that of a neurotypical person. As caregivers, educators, and parents, the most powerful tool we can offer them is to presume a general competence of skills we have yet to see them demonstrate. To provide a very basic example, speak to and about them like you would a neurotypical person. Do not talk about them as if they are not there or cannot hear you. Treating people with autism with dignity matters, and presuming competence about skills that you have yet to see demonstrated can be a huge part of that.